morning.
Good morning.
For the people that don't know you, would you mind introducing yourself and giving us a brief history about the background of your cartilage issue?
Sure, I'm Dr. Sharon Tighe. I've been here at Daytona State for quite a while. Many of you know me, but for those of you who don't, that's who I am. The hip problem is bone on bone. Unfortunately, it's the left hip, and I can't pinpoint any injury. There, no car accidents, no falls, nothing like that. It was just a progressive osteoarthritic type situation.
So what kind of signs and symptoms did you experience, and when did they start occurring?
Well, my brother had his hip replaced 2 years ago in February, so it would be the April of 2013 that I started having what I thought was sympathy pain in my left hip, since he had his right hip replaced. And I started getting twinges, starting having pain, thinking, oh, okay, well, my hip kind of hurts, but you never really know. So it wasn't until November of that year that I went and made an appointment with the orthopedic doctor, and they took x-rays. I was complaining of left hip pain and left knee pain because it's all gait related on that left side. So they did x-rays and said, well, the good news is there's just minimal arthritis in your knee, but there is severe bone-on-bone arthritis in your hip. And I was very, very shocked to know that. It was the same thing that happened to my brother 2 years previously. So
what kind of treatment options do they offer you?
Well, of course, the doctors want to do hip replacement right away because that's where they make the big bucks.
Right.
And I thought, well, that's not going to happen. Let's try something a little less invasive. So at that point, I just took the 6 months off. He says, well, return in 6 months and then we'll see. So it wasn't until May of last year that I returned to him. And of course, at that time, it was worse. The mobility was worse. The range of motion was worse. And he suggested hip replacement again. By that time, my mother had broken her ankle, and I have a new roommate, so I take care of my 96-year-old mother. So I said, let's do something a little less invasive. Let's go with the steroid injection, which is what we did on June the 10th.
So after your steroid injection, did that help you, or did you have another treatment option that was suggested to you to go from there?
Well, it helped. So it worked for about 5 weeks. I returned to the office a month after the injection. They asked how much improvement was there. I said, well, it's about 50% improvement. And they said, can you live with that? I said, yeah, for right now I can. And I wasn't walking with the cane, so I thought, okay. But that only lasted for 5 weeks. And it was supposed to last for 6 months.
Oh, nice. So from there, that's when they offered you the stem cell infusion?
Well, no, I had done some research on my own. One of the other faculty had a friend who had had the stem cell infusion by this doctor in Orlando. So I did some research on it, went on the internet, kind of researched this doctor, researched the process, because I didn't really know anything about it. So got the librarian to pull me some articles and did some reading and thought, well, if it would work for me, this would be a wonderful thing.
So, can you briefly explain the process of
Sure,
the stem cell
sure,
infusion?
sure. It was my own stem cells, so they're doing research with embryonic stem cells. That's another whole different area. Other stem cells from other people, other donors. These were autologous stem cells. They went into my right hip and did a bone marrow aspiration with no anesthesia, which really, really hurt. So they took out some big old huge syringes full of nice red plasma stem cells and put it in a machine. That took 18 minutes. That was the longest process. So they spun it down to a smaller syringe full, which they then injected into my left hip under fluoroscopy, and I got to watch that, so that was kind of cool. It was very painful, but it was kind of cool.
That's nice. So did you have any benefits from having this treatment done? If so, what were they?
My brother had taken me for that. I had that at kind of an outpatient clinic in Orlando. It was a little bit painful for the weekend, just kind of laid around for the weekend, and then got back to my normal routine. But no, there wasn't really any benefits that I saw. There wasn't any increase in mobility, there wasn't any decrease in pain, and I'm walking with the cane constantly now.
So would you say that there was a disadvantage, or did things get worse, or kind of stay the same?
The left hip kind of stayed the same. The problem is now I have sciatic pain in the right hip, because that's where they took the stem cells from, and I did not have sciatic pain in the right hip. Now I have sciatic pain in both hips.
Okay. So the other treatment option you used was the platelet-rich plasma, also known as PRP, and I actually did some research on that, and that procedure is commonly done by athletes, such as Tiger Woods. And basically what they do is the PRP provides growth factors or healing cells that repair the previous damage done. Can you briefly explain that process that you had done?
Sure. When I didn't get any relief, I made a return appointment to go back to see the doctor in February, and he offered me this. He says, well, if we do this, that will maybe jumpstart the stem cells. So I thought, okay, and he wasn't going to charge me any extra for this. I thought, okay, well, I had nothing to lose and everything to gain. So his assistant drew 60 milliliters of blood out of my arm. Again, that went through another machine. I don't know how they spin it down, but it spins down about half. So then he took that 30 milliliters, and of course he did this in the office, and injected it into two places in the hip socket itself. So it was quite a painful procedure. I felt like lightning going down my leg. But this is supposed to jumpstart the stem cells, and it's been almost 4 weeks. They said give it 4 to 6 weeks, and you should see some improvement. So, you know, the jury's still out on that one. I hope I get some improvement, but I'm a little bit skeptical.
Well, thank you for your time, and I appreciate everything, all the information that you've given us for this stem cell research that we're doing.
My pleasure.
Thanks, Dr. Tighe.